Hi, my name's Maureen Farrell, and I'm the Director of Community Wellness for the Regional YMCA of Western Connecticut. I have a background in nutrition and public health, and I'm proud to really announce that the Regional YMCA has successfully completed their first year of programming for the YMCA's Diabetes Prevention Program. Our participants have done extremely well, and we're very excited for the work that has been accomplished by all of them. But we need to do more. What we do know is that there's 36,000 adults in our service area currently at risk for type 2 diabetes today. That means 1 out of 3 adults are at risk for type 2 diabetes. And we can do something about that. Prediabetes is reversible, and it is reversible through lifestyle changes, such as what occurs by participating in the YMCA Diabetes Prevention Program.
My name's Lisa O'Connor, and I'm the program coordinator and a lifestyle coach for the YMCA's Diabetes Prevention Program. The Diabetes Prevention Program is a year-long program that starts off with 16 weekly sessions, followed by sessions every other week for 6 weeks, and then once a month for 6 months. So there are 25 sessions in all. And each week we focus about making a simple lifestyle change that can help you prevent or delay the onset of diabetes. So the changes are simple changes that are things that you can maintain long term. So for example, how to read labels, how to eat less fat. And we encourage the participants to think long term. Think about simple changes that you can make that will stay with you as habits 5 years from now or even 10 years from now. We don't want you to think about what do I have to do to get through the program, but rather what can I take from the program to help me create my new normal so that I'm always living a healthy lifestyle, and I'll always be able to prevent or delay the onset of type 2 diabetes. Participants who have finished the program have told us it was easier than they thought it was going to be. They're amazed at how easy these habits are for them to continue with, and that they've gotten their life back, which is the most important feedback we could ever get from a participant.
There are Ys in almost every community across the country, so YUSA and the CDC they've united together to work together to bring this program. Because the CDC, the Center for Disease Control, is concerned that by 2050, if we don't turn around the lifestyle habits of adults in our communities, 1 out of every 2 adults is at risk for having type 2 diabetes in the year 2050. Type 2 diabetes not only affects you, but your family as well. Improving your health can also impact the health of your children and the health of other adults that are living with you.
It's my pleasure to talk to you about the YMCA Diabetes Prevention Program and how it's impacted on my patients. I was excited to hear about this program several years ago at a National YMCA meeting, and then when it was finally implemented at the Regional Y of Western Connecticut in October of 2014, I had referred a lot of my patients to that program with the anticipation that they could benefit from all it had to offer. And my expectations were exceeded. I'm seeing patients now 15, 16 months after they started the program, and some who've enrolled more recently, and the success of those patients in achieving their goals in the program has been quite amazing. And for someone who's practiced Mesnir for over 30 years and tried all sorts of strategies over the years to help my patients lose weight, reduce their risk for developing diabetes and other chronic illnesses, this was quite an eye-opener, and it's a wonderful program. I've seen patients recently who just in the last 6 months with enrolling in the program have lost upwards of 50 pounds. They feel great about themselves. They're energized. And these are people who are busy. They're often people who are working full-time, have families, and so they don't have the luxury of lots of free time. But they've made the time to participate in the program, and using the tools that the program has provided to them, their success has been quite amazing.